Welcome to the Dr. Mudgil podcast. This is episode 97. We are at the end of September. It's wrapping up. It's been a wet one here in New York. It's pretty much, I feel like we live in Seattle. It's like rained every day for the last 4 or 5 days. We had a little bit of sun yesterday, but now we're back. It's cloudy. It's going to rain the next couple of days, so just waiting for that to pass. I think next week, according to my soon-to-be 14-year-old son, it's supposed to be a very nice week, so looking forward to that. Bring in October with a nice first week. So this podcast is going to be sort of another healthcare rantish type of podcast. I know you've probably heard many podcasts where I'm railing on private health insurance companies, which are the absolute most vile, disgusting institutions that there are. You know, companies like United Healthcare, Aetna, Blue Cross Blue Shield, Cigna. They do not care about you as a patient. They do not care about me as a doctor. They only care about their bottom line and their profit margin. But that is a discussion for past times and future times, I'm sure. This podcast is going to be more about private equity in healthcare, which is a big thing. So I'm going to talk a little bit about what that is and why that's bad for patients. But I'm going to set a little bit of a framework. So here we go. So there's basically two sides of the fence, in my opinion, when it comes to healthcare. There's one side of the fence where there's the doctor and the patient. The patient comes to the doctor because they're not feeling well or they have something that they're concerned about. And the doctor wants to help their patient. So sometimes they evaluate their patient. They may order some tests for their patient. They may do a skin biopsy. They may order some blood work, to better evaluate their patient. The patient comes to the doctor because they want to get better, and the doctor wants to help their patient. That's as pure of a relationship as there can be. But on the other side of the fence are 4 evil forces that get in the way of the doctor-patient relationship, which is really one of the purest relationships there is. Again, patients come to the doctor because they need help, and doctors go to school for a gajillion years. I mean, most doctors don't start earning a dollar until they're in their 30s. And they do this because they want to help people. They want to help the patients that come to them. Now, on the other side of the fence, there's 4 evil forces, like I said. There's evil insurance companies, United, Aetna, Cigna, all those companies, worst institutions in the world, only care about maximizing their profits off of patients' backs and off of the doctors that take care of them. They're big hospital-based systems, which are also evil. They're just bloated with useless admins. I think there's some crazy statistic where there's 13 administrators for every one healthcare provider that's actually providing care to patients. I mean, that's just insane. Think about all of those dollars that could be going towards taking care of patients that are going to pay some admin salary who's some MBA who has no effing idea what it's like taking care of patients or how to deal with someone who's sick. They're literally useless admins that are just clogging up and just eating dollars that should be allocated to healthcare. The third party are big pharma. And there's just so many things to say about big pharmaceutical companies like Pfizer, Moderna. I'm not going to get into all of the details here, but if you just think about the COVID vaccine in general, all right? And this is not any kind of commentary on the COVID vaccine itself, but Pfizer and Moderna collectively made $51 billion last year off of the COVID vaccine. And you may say to yourself, well, yeah, but, they did all this research, they developed this vaccine really quickly, and they did. But that research is funded by you, and me. It's our taxpayer dollars. These are NIH grants that fund the researchers. These private companies are using government dollars, which you and I are paying into, to subsidize their research. And they go on to develop, amazing medications, but that are sold at astronomical prices. They're in cahoots with the private insurance companies because they'll negotiate some, back alley deals to say, hey, I'm going to sell you, I only want you to use Pfizer medication. And I'm going to give you 50% off. And the insurance companies, of course, are going to do that because they're getting a kickback, which is essentially kickback. They're getting a rebate, which is just padding their bottom line, increasing their profit margin. It's a whole shady, nefarious system. Again, a conversation for another podcast. And the fourth evil player are private equity companies. So private equity companies are companies that buy up practices. They'll buy up your primary care doctors, they'll buy up dermatology offices, they'll buy up ophthalmology offices, urologist office, orthopedic surgery offices, vets, dentists. And their whole goal is obviously to commoditize the patient. So, patients aren't people. They're not humans. They're literally like cogs and dollar signs. And the more patients that they can drive into their system, they basically build up their practice to sell it to someone who's going to pay more than they paid for it. So say, someone buys a practice, a private equity company buys a practice for like $1 million. They'll do whatever they can to drive more patients. And I'm going to talk to you about some of the tactics that they use. And they'll try to sell it to some other company for like $10 million. So that's how they make money. They're private equity companies. They invest in a business. They try to grow that business so that they can sell it for more money and obviously make money, because for these guys, money makes the world go around. The problem with that philosophy in healthcare is that patients are not commodities. They're people. Your mom, your dad, your brother, your sister, your best friend, those are patients. Those are folks that may get sick and may need the help of a doctor. And sometimes decisions that need to be made by doctors aren't objective decisions like, okay, well, if we deny this medication, then we make this much dollars. And, it's about helping people. Sometimes you have to make an financially irrational or an objectively financial irrational decision to help somebody. So I'll give you like for instance, and this is going back to health insurance companies, not private equity, but say your doctor says you need to get an MRI to evaluate your back pain, right? Your doctor doesn't benefit from that at all. You're coming in with back pain. Your doctor says, hey, an MRI is what's really going to help me evaluate your back pain and see how best I can help you, whether it's a surgical issue or whether we can do shots or whatever the case, physical therapy. But your insurance company will invariably deny it. And they're not denying it for any other reason than to, bolster their profit margin. If they pay for your MRI, you and I have already paid our healthcare premium. So, we've already paid into the pot. But the goal of the insurance company is to keep as much money in that pot as possible. So they're going to say, hey, no, you cannot get an MRI exam. So then you're suffering with pain. Your doctor's hands are tied because, they can't do anything but appeal the decision, and most of the time the appeals are denied. It's a whole horrible system. But again, that's talking about private insurers. Private equity companies do like similar things, right? So they're trying to like bolster the profit margin of the practices that they buy. So for instance, they will just like they'll take every insurance and they'll just load up their practices with fresh out of school physician's assistants who literally know absolutely nothing about, say, like dermatology, for instance. And these young PAs who have just fresh out of school will see 40 patients a day, have literally almost no idea what they're seeing. They're just like kind of learning on the fly, if they're learning anything at all, because there's, very little, if any, oversight. And who suffers? The patients suffer. Who benefits? The private equity company benefits because patients are commoditized. Patients are dollars to them. They don't care about people. They care about maximizing their profits. And I'll give you some examples. So in the New York City area, there are like 3 largish private equity-backed dermatology groups. There's one that's like pretty decent. The doctors actually they're good doctors, and they make decisions for or along with the private equity folks, the business folks that are sound, and it's I'd say it's like a 7 or 8 out of 10. It's a slow-growing practice. They have good providers, and they try their best to do the right thing by patients. Then there's the second one, which is like the largest private equity-backed dermatology practice in the area, and they pretty much do what I just described. They'll buy a practice, they'll buy like solo practices, small practices, then they just like load them up with PAs and just try to maximize the output of that practice. And the care is poor. I would say it's moderate at best, but by and large poor, and they're like a 4 out of 10. And then there's another group which egregiously and aggressively follows this model of just running an insurance mill, dumping PAs in their practice. The PAs are like just are workhorses. They don't know much. They may have like a little brief training period, and they're just run into the ground. And they're kind of like, I see a lot of spillover from these practices. And to me, they're kind of like the armpit of dermatology in the New York City area. I mean, they literally have no regard for people. It's literally about just making as much money as possible off of poor patients who are coming to them for help. And that to me they're just as vile as health insurance companies, who also could care less about you as a patient, or they certainly don't care about me as a doctor. For them, everything's about profit. For some private equity companies, some are better than others, obviously, but for this one I'm describing, which is like the 1 out of 10, the most nefarious of the group, they could care less. I don't know how any of these folks even sleep at night. And that is the problem when folks get in between doctors and patients. Again, patients come to doctors because they're seeking help in a time of need. Doctors do all of this schooling, and they are in this business for, because they want to help people. They want to help people get better. That's why, they will go through the grueling, pre-med, med school, internship, residency, fellowship. All that stuff is hard, and doctors endure it because they love it. They have a passion for helping people. The problem is there's these outside forces that interfere with doctors trying to help patients, interfere with patients trying to get help from doctors. And a big part of that problem, at least 25% of the problem, one of the 4 evil forces that are interfering with the doctor-patient relationship are private equity companies. The day of the solo practitioner like myself, sort of these mom and pop shops, though we are few and far between. Hospital-based systems are buying up practices, private equity companies are buying up practices, and it's all done to maximize profits, increase dollar amounts that these private corporations are making, and again, it's off of the back of you as a patient and me as the doctor who's trying to help their patient. So the reason why I talk about these things is because it just shocks me that doctors as a whole aren't talking about these things. It shocks me that patients aren't talking about these things. It's up to us, patients and doctors, to make some noise and talk about this bullshit that's going on in our healthcare system. Our legislators certainly aren't going to do a damn thing for us because they're in bed with big pharma, they're in bed with private equity companies, they're in bed with hospital systems, they're in bed with private health insurance companies, because all of these folks are feeding into their campaigns and all that behind the scenes bullshit with PACs and stuff. And us lowly doctors and patients are kind of left to the lurch, and we're kind of stuck because no one's advocating for us. So it's important that we, patients and doctors, that we advocate for ourselves. The more awareness that we bring to these issues, the more likely change, much needed change, will occur. So with that, that's something to think about. I hope you all have a wonderful, restful weekend and are just ready to crush the week ahead. Let's get it. Thank you so much for listening to this podcast. The full video for this podcast can be found on either YouTube or Facebook. Let's get it.